Welcome back to Remedy Science. In today's video, we'll dive into the fascinating world of lung anatomy and explore some of the most common lung diseases. Whether you're a student, healthcare professional, or just curious about how your lungs work, this video will give you a clear and detailed overview. Let's get started. Anatomy of the lungs. Lobes. The right lung has 3 lobes, superior, middle, and inferior, while the left lung has 2 lobes, superior and inferior. The left lung has 1 less lobe due to the space occupied by the heart. Segments. Each lobe is divided into bronchopulmonary segments, which are functionally independent units. This segmentation helps in isolating and treating infections or other issues. Bronchi. Primary bronchi. The trachea divides into the right and left primary bronchi. Secondary, lobar, bronchi. Each primary bronchus branches into secondary bronchi, which supply each lobe of the lung. The right main bronchus branches into 3 secondary bronchi, 1 for each lobe, while the left main bronchus branches into 2. Tertiary, segmental, bronchi. These further branch from the secondary bronchi and supply specific bronchopulmonary segments. Bronchioles. Terminal bronchioles. These are the smallest bronchioles before reaching the respiratory zone. They are less than 1 mm in diameter and lead to the respiratory bronchioles. Respiratory bronchioles. These bronchioles have alveoli budding from their walls and are involved in the initial stages of gas exchange. Alveoli. Alveoli are tiny, balloon-like structures with extremely thin walls, 1 cell layer thick, that are surrounded by a dense network of capillaries. This design maximizes surface area for gas exchange. Types of cells. Type 1 alveolar cells. These form the majority of the alveolar wall and are involved in the gas exchange process. Type 2 alveolar cells. These secrete surfactant, a substance that reduces surface tension and prevents alveolar collapse, atelectasis. Alveolar macrophages. These are immune cells that help clear debris and pathogens from the alveolar surface. Pleura. Visceral pleura. This is the inner layer that tightly adheres to the lung surface and follows its contours. Parietal pleura. This is the outer layer that lines the inner chest wall and diaphragm. Pleural cavity. The space between the visceral and parietal pleura contains pleural fluid, which lubricates the pleural surfaces, allowing smooth lung expansion and contraction. This structure facilitates efficient gas exchange and provides a protective barrier for the lungs. Common lung diseases. Chronic obstructive pulmonary disease, COPD. Causes. Chronic obstructive pulmonary disease develops primarily due to long-term exposure to irritants such as cigarette smoke, air pollution, occupational dust, and chemicals. Symptoms. People with COPD often experience chronic coughing that produces mucus, sputum, shortness of breath, especially during physical activities, wheezing, a whistling sound while breathing, chest tightness, and frequent respiratory infections. Asthma. Causes. Asthma is a chronic condition triggered by various factors, including allergens, like pollen, pet dander, and mold, respiratory infections, physical activity, cold air, and emotional stress. Symptoms. Symptoms of asthma include recurrent episodes of wheezing, especially during exhaling, shortness of breath, chest tightness or pain, often described as a feeling of pressure in the chest, and coughing, which can be worse at night or early in the morning. Pneumonia. Causes. Pneumonia can be caused by bacterial, viral, or fungal infections. The most common bacterial cause is Streptococcus pneumoniae. Symptoms. Typical symptoms of pneumonia include a productive cough, producing greenish, yellow, or bloody mucus, fever with shaking chills, rapid breathing, chest pain worsened by coughing or deep breathing, fatigue, weakness, and confusion, especially in older adults. Tuberculosis, TB. Causes. Tuberculosis, TB, is caused by infection with the bacterium Mycobacterium tuberculosis, primarily affecting the lungs but potentially spreading to other parts of the body. Symptoms. Symptoms of TB include a persistent cough lasting more than 3 weeks, sometimes with blood-tinged sputum, hemoptysis, chest pain exacerbated by coughing or deep breathing, weight loss, loss of appetite, fever, often in the afternoon or evening, and severe night sweats. Lung cancer. Causes. Lung cancer typically develops due to long-term exposure to carcinogens, such as smoking, including secondhand smoke, radon gas, asbestos fibers, and certain industrial chemicals. Symptoms. Common symptoms of lung cancer include a persistent cough that worsens over time, chest pain worsened by deep breathing, coughing or laughing, shortness of breath, wheezing, coughing up blood, hemoptysis, unintentional weight loss, and loss of appetite. Pulmonary fibrosis. Causes. Pulmonary fibrosis involves progressive scarring of lung tissue, often due to environmental toxins, such as silica dust, asbestos fibers, autoimmune diseases, like rheumatoid arthritis, or idiopathic causes, unknown reasons. Symptoms. Symptoms of pulmonary fibrosis include gradual onset of shortness of breath, initially during physical exertion and later even at rest, a persistent dry cough, without producing mucus, fatigue, weakness, unexplained weight loss, and clubbing of the fingertips, enlarged and rounded fingertips. Bronchitis. Causes. Bronchitis can be acute or chronic and is commonly caused by viral infections, like rhinovirus, influenza virus, bacterial infections, less frequently, or irritants such as cigarette smoke, air pollution, or dust. Symptoms. Symptoms of bronchitis include a productive cough with yellow or green mucus, acute bronchitis, chronic cough lasting at least 3 months over 2 consecutive years, chronic bronchitis, shortness of breath, wheezing, chest discomfort or tightness, mild fever, and fatigue. Cystic fibrosis. Causes. Cystic fibrosis is a genetic disorder caused by mutations in the CFTR gene, affecting chloride transport across cell membranes and leading to thick, sticky mucus production. Symptoms. Symptoms of cystic fibrosis include a persistent cough with thick, sticky mucus production, recurrent lung infections, often with bacteria like Pseudomonas aeruginosa, shortness of breath, wheezing, poor growth and weight gain in children, and chronic sinus infections. We hope you found this guide to lung anatomy and diseases informative. For more tips on improving your respiratory health, check out our previous video on natural remedies for clearing mucus and improving breathing. Don't forget to like, subscribe, and hit the bell icon for more educational content. If you have any questions or topics you'd like us to cover, leave a comment below. Thanks for watching.